7 changes you can make to your daily routine to reduce your risk of breast cancer. Do you worry about becoming 1 in 8 women diagnosed with breast cancer annually? Or maybe you're a survivor who's wondering if the same steps you take to prevent recurrence could also lower your friend's risk of developing cancer. Either way, we have a few small suggestions to help prevent developing cancer or experiencing recurrence. Lifestyle changes can prevent you or someone you love from facing the scariest change of all: living with breast cancer. But first, we'd like to thank our sponsor, Breast Cancer Index. It's a test that may help women with ER-positive, early-stage breast cancer decide with their doctor whether to extend or end anti-hormonal therapy after 5 years. It's surprising what a difference lifestyle can make in cancer prevention. Across the board, cancer experts agree that this list of steps can lower your risk of developing cancer while lowering a survivor's chance of recurrence. And the good news is that these steps help, even if you happen to be a high-risk woman. Number 1, don't smoke. The research is clear. There's a link between smoking and breast cancer risk, especially in premenopausal women. Okay, so it's bad for your overall health. But if you want motivation to quit smoking, protecting yourself from breast cancer is a great reason to quit. But if you need more motivation, keep in mind that besides lung cancer, tobacco use also increases the risk of cancers of the mouth, lips, nose and sinuses, voice box, throat, esophagus, stomach, pancreas, kidney, bladder, uterus, cervix, colon, rectum, and ovary, as well as acute myeloid leukemia. It also raises the risk of many other health problems, including heart and lung diseases. Kicking cigarettes is always easier said than done, until your life is on the line. Then you won't have a choice. Number 2, limit your drinks. A cocktail now and then isn't the problem. In fact, there's no magic limit to gauge your additional risk of breast cancer. Just know that the more you drink, the greater your risk. Experts suggest, as a general rule, you should limit your alcohol intake to less than 1 drink per day. But if that's true, then why are some reports suggesting that wine improves your health? Isn't a daily glass of wine supposed to be better for your heart? The answer is that studies on alcohol's effect on health were conducted for very different reasons. While the resveratrol in wine may offer mild benefits for the heart, the Journal of the National Cancer Institute confirmed that for cancer, there's no level of alcohol consumption that can be considered safe. Number 3, weight control. It's something most women worry about for lots of reasons, but barely because they're afraid of cancer. However, we now know that being overweight or obese increases the risk of breast cancer, especially in postmenopausal women. The reason for this increased risk seems to link to the estrogen levels in fat tissue. The more fat in the body, the greater access the body has to estrogen, which is what feeds hormone receptor positive invasive carcinoma of the breast. This is the most common type of breast cancer. To be more specific, keeping a healthy weight with a body mass index below BMI 25 is highly recommended. And all those other reasons you wanted to lose weight will benefit from your healthier body as well. Number 4, stay active. Regular exercise can lower breast cancer risk as much as 20%, and that is a huge advantage. But just how much exercise? The Department of Health and Human Services suggests 150 minutes a week of moderate aerobic activity, or 75 minutes of vigorous aerobic activity, plus strength training at least twice a week. So let's break it down. For moderate exercise, just walk 30 minutes a day for 5 days. All that leaves is some strength training on the other 2 days. And that's all it takes to lower a risk significantly. Number 5, breastfeed. Breastfeeding may play a role in breast cancer prevention. Studies have found that the longer you breastfeed, the greater the proactive effect. So if you're having a baby, think twice before deciding not to breastfeed or ending breastfeeding early. Number 6, limit the use of hormone therapy. If you're taking combination hormone therapy for more than 3 to 5 years, you're increasing your risk of breast cancer. If it's for menopausal symptoms, ask your doctor about other options, or at least take the lowest dose that works for you. Also, make sure to monitor how long you've been taking hormones, as they shouldn't be used indefinitely. Number 7, avoid radiation exposure and environmental pollution. Even medical imaging methods such as computerizing tomography use high doses of radiation. While this is still being studied, some research suggests a link between breast cancer and radiation exposure. So whenever possible, reduce your exposure by only having imaging scans when it's absolutely necessary. Of course, living a healthy life helps resist many different diseases, not just cancer. We look at each benefit as contributing to a more fulfilling life overall. not just changes to protect against breast cancer. To get more practical tips for breast cancer patients, be sure to subscribe to Breast Cancer Answers here and leave your own questions in the comments below. We'll do our best to answer your questions in future videos. We'd also like to thank our sponsor, Breast Cancer Index. To find out more about your treatment options beyond year 5, just click the button and download our free list of 15 questions to go through with your doctor.